Good morning, David Johnson here from the Functional Movement Training Centre, the Back Pain Centre and City to Coast Neurosurgery. We have a special guest, Mr. Sam Wells, one of our functional movement therapists, and an even more special guest, Elsie Bones. And this morning, what I want to talk to you guys about is understanding one of the movement points of performance, which is deeply entrenched in our NeuroHab program, our movement therapy program, and that is understanding hip-centric rotation and the difference between hip-centric rotation and lumbar-centric rotation. Many people out there with back pain, and also the patients that we see who have back pain, have symptomatic degeneration at the lumbar motion segments, and I'm sure you will have heard people talking to you about your L4-5 or your L5-S1 disc degeneration. Now, disc degeneration in isolation should not cause you pain, but if you develop degeneritis, that means that your degeneration at those lumbar segments is now inflamed, and going hand in hand with inflammation is pain. So how do we stop our lumbar degeneration, which is normal? It's a normal part of aging. How do we stop our lumbar degeneration transforming into lumbar degeneritis? One of the key points is that we want to maintain our bending movements. We want to maintain those movements as hip-centric, okay? And if we come in here, we zoom in on the hip joint, we can see here very clearly that the hip joint is what we refer to as a ball and socket joint. And a ball and socket joint is a little bit like the tow bar on your caravan or your trailer. It's designed for rotation. Now, if we look at Elsie and get her to do a bending movement, a very common bending movement, for example, bending over to pick up a TV remote control or bending over to pick up a newspaper off a shelf. Watch Elsie as she moves into her bending position. Okay, so I'm going to put Elsie on the ground, and there we can see that Elsie is moving with hip-centric rotation around this ball and socket joint, and we maintain what's called the neutral spine position. Okay, now if I demonstrate, Sam's going to step in here and on side view. Here's Sam demonstrating the neutral spine position with his stick. Now let's demonstrate good movement now with hip-centric rotation. The hip joints are there. And so Sam, if you demonstrate that, there's Sam doing a movement that would be a very common part of everyday activity. Okay, so now Sam, if you can demonstrate to us paw movement where your center of rotation is migrating northwards into the lumbar region. So demonstrate that, keeping an eye on this spine here, and see as we see Sam bending, and say he's got to bend a bit further just to accentuate that paw movement. Okay, and what we can see is that yes, there is a little bit of rotation happening here, but as Sam does the paw movement again, there's also what we call lumbar-centric rotation. So the center of rotation is migrating north in this direction. Okay, stand up nice and tall there, Sam. So that's good. What we can see then, if Sam does that movement, how did your body feel, Sam, when you were moving poorly? Could you feel some mechanical stress that just didn't feel right, didn't feel comfortable?
Yeah, definitely in the lower back.
Yeah, it doesn't feel right to move dysfunctionally, and the spinal motion segments are really, they don't have the structural integrity to maintain that poor movement every day of every week of every month of every year. But if you are not taught how to move correctly, the way Sam demonstrated the first time with that nice, let's just demonstrate that good movement again. And now, where are you feeling the work's being done? In the muscles. Yeah. The muscles and what we call the posterior kinetic chain are doing all the work, and the back feels really strong and powerful. there's no mechanical stress on the back because muscles are designed specifically to take load. But little old disc here, L45, L5S1, is not designed to take that repetitive lumbar centric rotation. And if our cameraman just comes in and shows us what the disc looks like at L45, L5S1 and L34, these guys do not have the anatomy or the form as compared to this to tolerate that type of repetitive lumbar centric rotation. There's a huge difference between the structure of the spine here and the hip joint, and that's why a critical teaching point in our movement therapy program, our Functional Movement Training Center NeuroHab program, is learning how to develop as a default movement pattern hip-centric rotation. And we train that into our patients by focusing on the central nervous system. The central nervous system is up here. This is our motor cortex. Our motor cortex is in charge of how our muscles move our skeleton, and therefore our program is called NeuroHab, which is distinctive and unique to every other form of rehabilitation program for back pain. So I hope that makes sense to you guys. Short little quick video, but some very important concepts that we've demonstrated there. Okay, take care, see you next time.
Calling you over, my head on your shoulder.